Dr. Beyrer, in your note to us this morning, you go to the heart of the matter, which is we are confusing our science and anti-science with the fear of a legitimate variant, Omicron, an identified variant, Delta, and the fact the weather's changed and we're inside as well. What matters now, the weather or the variants?
Well, it's both. So what we're seeing, of course, is a winter surge that had been predicted. This is still with Delta in Europe and the U.S. Right now, the highest rates in Michigan, Indiana, and Ohio of hospitalizations. Most of that is Delta. Only about 2% now of sequences in the U.S. are Omicron. But the infection curves for Omicron, and I've seen the data for the UK, for Germany, and for the US, look even steeper than we saw in South Africa. So Omicron is spreading very rapidly. The vaccines do appear to be holding, but definitely with lower efficacy than we saw against the other variants.
Is Omicron virulent?
The virulence question is still somewhat uncertain. We have to remember that where this emerged in Southern Africa, the populations are younger. They have had much more exposure. There's less vaccination, but there's been more COVID. So the populations are 80% of people have already had COVID, mostly with Delta. So it's hard to say what the virulence is going to look like in older populations like ours. But it's so infectious that the infectivity might lead to many, many more hospitalizations and severe illnesses. And of course, as you know, Tom, in the US, we're only now at about 62% of total population vaccinated. That's not enough to hold this off.
Dr. Beyrer, do you think that people are overly complacent about the risk of another wave of infection similar to what we've seen with Delta or even beyond, given what you're currently seeing with Omicron?
I don't know if I would use the word complacent. I think people are exhausted. And we're seeing that in many, many countries, that there is rising resistance, popular resistance to the new restrictions. A lot of that is driven by the fact that we're coming into actually what will be the third year of this pandemic. And the social, mental, emotional costs, economic costs, supply chain costs have been really high and are exhausting people. We all know that.
Well, Dr. Beyrer, given that, do you think it is the wrong tack to take to start with some more restrictions on travel and other types of things that we're seeing, given that they haven't really been borne out in terms of providing a health benefit, stopping the spread, and it just adds to this exhaustion?
Well, I think that's right. What we saw is that the travel restrictions were not sufficient to contain Delta, which is more infectious than the earlier variants. Omicron looks to be perhaps twice as infectious as Delta. And as we've seen, despite quick attempts to contain this variant with travel restrictions, it just hasn't held. We already have Omicron in 37 states in the US, for example. And as I said, the infection curves are incredibly steep. This is a very infectious variant. I think the things that matter more, certainly the science is suggesting vaccination really matters, boosting. Everybody who's eligible in the U.S. now, that's 16 and 17 and up, should be boosted as soon as you can. That is really critical. And of course, you know, the non-vaccine kinds of things that we need to do, masking on planes and trains and indoor masking where you don't know other people's vaccine status, that's all going to matter too.
Doctor, I'm interested in, therefore, as you say, the booster is the right course of action, which seems to very much be the focus of the US and the UK. How quickly does that increase your ability to fight off Omicron, for example? Is it still that 2-week window until you find that you increase your powers within to be able to ensure that you're not getting infected at quite the highest rate?
The antibody response from boosting probably starts to go up almost immediately. So you are more fully there by 2 weeks, but you start to see the benefit within a matter of days. It's impressive how much of an we call it a immune memory response there that we see, which is that given another dose of vaccine, the body really rallies and the antibody titers go up dramatically, not a little, a lot. So that's really important. We also have data now, WHO has been collecting data from a number of countries that have had to mix vaccines because they've had a variable supply. Many of them started with AstraZeneca from India, then they had to switch to something else, to J&J. And the data there are quite compelling, particularly if you mix classes of vaccines. So people, for example, getting a J&J and then having an mRNA boost, that also looks encouraging. We're not recommending it, but for those countries that don't have a choice, it's a good option.